Hi guys, so welcome back. I did talk about type 1 diabetes mellitus topic in the previous video. If you haven't find out and want to learn about the type 1 diabetes, so the link is in the description below. Feel free to learn and asking any questions. So today's topic is type 2 diabetes mellitus. So let's begin the presentation. The aim of this presentation to understand the definition, the etiology, the symptoms, risk factors, pathogenesis, diagnosis, interventions, and how to prevent or control type 2 diabetes mellitus. So what is type 2 diabetes mellitus? The Diabetes Australia scheme is a government scheme. They define type 2 diabetes mellitus as a metabolic disorder when body is resistant to insulin effects. In turn, it gradually loses ability to produce insulin inside the pancreas due to insulin resistance. Elevating glucose level in the bloodstream triggers all people at any ages. So type 2 diabetes mellitus does not discriminate any ages, genders, or ethnicity. It triggers all people with unhealthy, modifiable lifestyles. So what is the cause of type 2 diabetes mellitus? The etiology of this disorder does not link to specific susceptible genes like type 1 diabetes mellitus, but the stress level, diets, and lifestyle contributed into type 2 diabetes mellitus development. Pancreatic duct obstructions can lead to diabetes because of the pancreatitis, its inflammation, affecting the insulin-producing cells. So type 2 diabetes mellitus can stop or slow the progress of to prevent sugar from elevation when changing the diet with medication control and changing lifestyles and improve physical activities. So unlike the type 1 diabetes, it cannot be prevented. It's incompletely cured and lifelong. But type 2 diabetes is similar, like it's a lifelong disorder, but it can control or slow down the progress of the sugar. So in this case, type 2 diabetes can be prevented, but type 1 diabetes, it's hard to prevent. So understand what are the risk factors influencing type 2 diabetes mellitus. So again, the risk factors really pretty much similar to type 1 diabetes. For those with family history of having type 1 diabetes or type 2 diabetes inside the house, so they live together, so they may transmit those the disease with each other. The age factor, so type 2 diabetes will be more likely affect elderly people, increasing age over 35 years and above. Those with hypertension, history of hypertension, being overweight or obesity or high body mass index individuals are prone to develop type 2 diabetes mellitus. Having excessive sugars in diets, so excessive sugars in consumptions in diets and refinery foods will increase glucose level. Severe infection that alters the immune system, attacking the pancreatic beta cells and helper T cells, causing alterations to insulin production, which means the body can produce insulin but cannot use it effectively. So the type 2 diabetes also linked to prolonged physical inactivity, eating unhealthy diets, again with high sugar. Genetic mutation due to hypertension and hypercholesterolemia are comorbid to type 2 diabetes. The specific group that develop type 2 diabetes are Aboriginal and Torres Strait Islander people, people from Pacific Island, Indian continent, and Chinese background. For women, they're more likely to get type 2 diabetes than men. So women who gave birth for a child weighted over 4.5 kilograms. So the child weighed over 4.5 kilograms. So the mothers are likely to diagnosed with type 2 diabetes mellitus if unprotected. Women with polycystic ovarian syndromes. So I cannot explain much detail about this syndrome, but it links to ovarian, so it's linked to the kidney. Pregnant women who had gestational diabetes and transmit it to their children. Prolonged use of steroid medication. So for the patient who used the steroid medication, the side effect can also elevate the glucose level. So usually steroid is used for those with cancer. So people who are using the steroid medication to treat cancer, the side effect and prolonged use of that medication can increase their sugar level and then comorbid into diabetes and it's type 2. The environmental trigger from urine transmission, again, if living in a family and family history of having diabetes or the member having diabetes, so most likely to infected where urine transmissions, sharing the same toilet or wet seat contain patient's urine. The combination of genetic and virus infection causing type 1 diabetes mellitus and then develop into type 2 over time. Sharing and using the same household products like toothbrush, spoons, drinking straw, or cups, etc. They're more likely to transmit with the patient's saliva, urine, blood, and bodily fluids. Unprotected sexual transmissions also can increase the risk of type 2 diabetes. This disease also comorbid with some specific clinical manifestations. I will explain about leukemia cancer. It's related to white blood cells. So again, sorry, yeah, it's so this cancer will also increase the risk of type 2 diabetes. Those with severe asthma, inflammations, cystic fibrosis, arthritis, and inflammatory bowel disease linked to virus infection. So which means it influences type 2 diabetes. The symptoms of type 2 diabetes is similar to the type 1 diabetes. So being excessively thirsty, a high urination frequencies, like more than usual, feeling tired and lethargic, always feeling hungry, having cuts that heals really slow, itching skin infection, blurred vision, gradually weight loss, mood swings, headache, feeling dizzy, and leg crampings. So the symptoms exactly the same to type 1 diabetes mellitus. And the clinical manifestations that linked to type 2 diabetes can develop in heart attack and hypertension. So if the patient have heart attack and hypertension, they are more likely to increase the risk of type 2 diabetes mellitus. So here, I will explain a little bit about excessive sugar level that damage the nerves, causing chest pain and leading to heart attack. Then the type 2 diabetes increases blood clot formation. It causing blockages and damages to the arteries, leading to blood vessel stiffness and then heart attack. Excessive sugar builds up like from fat deposit, or we know as plaques formation inside the bloodstream, causing inflammation, and it reduces the heart rate. So this condition is known as atherosclerosis. Patient might experience bradycardia or low heartbeat and appearing tiredness when diagnosed with type 2 diabetes mellitus. Insulin resistant. So type 2 diabetes, because of the insulin resistant, it triggers kidney to reduce the fluid and sodium filtration. So the kidney cannot excrete filter any fluids or sodium, that it leads to fluid overload. And in this term, we call it hypernatremia. It increases urination. So hypervolemia, like increase the urination that expands blood volume and result in hypertension. This is why type 2 diabetes mellitus are more likely to develop hypertension and heart attack. So what are the pathophysiology of type 2 diabetes mellitus? So type 2 diabetes mellitus develops when pancreatic beta cells of human's adaptive immune system overproduce insulin production inside the pancreas. It stores insulin inside the body for many years, leading to ineffective management of insulin to balance glucose level in the blood. It results in insulin resistance. So the pancreas functions to co-produce more insulin to manage glucose level. Then it loses pancreatic beta cells of the adaptive immune system due to self-ingestion. But this part is not an autoimmune disease, it's a metabolic disorder. So result, human skeletal muscles and adipose tissue metabolize blood sugar level ineffectively. And gluconeogenesis produced from the liver are unable to prevent pancreatic beta cell to stop the self-producing insulin. So then it exhausting the pancreatic beta cells and unable to metabolize intestinal glucose absorption. The pancreatic beta cell becomes insufficient and dysfunction, and lowering insulin productions over a period of time. So the comorbidity of excessive sugar consumption in diet, when glucagon hormone of pancreatic alpha cells elevate glucose level, then it decreases the insulin production and cannot control or decelerate sugar in the bloodstream anymore, then leading to type 2 diabetes development. So these are the pathophysiology. And I did create into dot points in a sequence order. So the diagnosis of type 2 diabetes mellitus is the same as type 1. It involves blood tests. Like blood tests to check the full blood count is important. Check the C-reactive protein for any infections. ESR to check the inflammation. Again, I did show the normal range in the presentation slide. Blood tests where blood glucose level check and ketone level check to check the sugar level on nutrition. And the normal range of the ketone should be less than 0.6. Blood glucose normal range should be 4 to 8. And between 5 to 7 should be on pre-diabetic medication to control the diabetes. Autoantibody test, it's maybe essential for type 1 diabetes and not really necessary for type 2, but it's important to understand that the normal range is negative results. C-peptide protein test, or known as CPP, it's to observe insulin production in the pancreas. It's important to know the insulin levels so that we can manage the interventions for type 2 diabetes effectively. And pancreas biopsy is a rare diagnosis. Urinalysis is important as well to check the sugar level in the urine. A1C test to observe blood sugar level over the past 2 to 3 months after diagnosis. So to know that the hemoglobin level should be below 48 millimole per mole after A1C test. So these are the diagnosis of type 2 diabetes mellitus. So what are the intervention? It's involved medication, non-pharmacological, and surgery. So for the medication, I cannot explain really detail about the name. But I can discuss about some important medications. So the Diabetes Australia government schemes reported that there are some specific medications that can treat type 2 diabetes mellitus. It includes metformin for type 2 diabetes mellitus and gestational diabetes for pregnancy mothers and children. I can explain the side effect of each one as well. So metformin, the side effect can cause nausea, diarrhea, loss of taste, and stomach ache. DPP-4 inhibitor, it's another medication with the generic name empagliflozin. So it increases insulin level after eating and to reduce glucose level in the liver. The side effect can cause runny nose, stiff nose, muscle spasm, joint ache, headache. The SGLT2 inhibitor is another medication for type 2 diabetes mellitus to increase glucose, where kidney excretion to remove excessive sugar, where urination. It reduces cardiovascular disease that link to diabetes that affect the kidney. So the side effect will cause high urination frequency, like more often than usual, urinary infection, genital thrush, dehydration, or rare diabetic ketoacidosis when the blood becomes acidic. These are just side effects. And sulfonylurea is another medication that used to release more pancreatic insulin level, usually where administered oral to digest during meal to lower the blood glucose level, and it affects the driving ability if those who are on this medication. It can cause side effect of hypoglycemic, like low sugar level, weight gain, and cannot take this medication before or after consuming any alcohol. Alpha glucosidase inhibitor is another medication to slow down intestinal glucose absorption to treat type 2 diabetes mellitus. The side effect can cause bloating, flatulence, diarrhea, stomach discomforts. This one is a little bit too pronounced, but we know it's a glitazones. It's another medication that promotes insulin function to reduce insulin resistance for type 2 diabetes mellitus. The side effect can cause fluid retention and weight gain. This one is GLP-1. It's an injection. The full word should be glucagon-like peptide 1. Remember, glucagon hormone is it produces by the alpha cell, pancreatic alpha cells in the liver. So glucagon-like peptide 1 injection, it will prevent excessive hunger from type 2 diabetes mellitus symptoms. It's also used to improve weight loss and cardiovascular events. So usually type 2 diabetes symptomized with excessive hunger. So GLP-1 injection will help prevent the hunger. So GLP-1 cannot substitute with insulin injection or pump. So then, which means insulin pumps or injection is also important to control type 2 diabetes mellitus. But for type 2 diabetes mellitus, these are the medications that can control or prevent or reduce or slow down the progress. But for type 1 diabetes mellitus, the medication need to be used daily, like daily insulin injection. And only insulin that is the only medication for type 1 diabetes, because it's a lifelong disease, because it's autoimmune. But for type 2, there's so many options. Non-pharmacological intervention, just the lifestyle changes, like changing in the diet to reduce sugar level, improve more physical exercise, sleeping, prevention, etc. The surgical intervention for type 2 diabetes mellitus called bariatric surgery. The bariatric surgery is a metabolic surgical procedure to remove at least 80% of the stomach lining that alter digestive system to reduce weight. So this surgery is people can undergo this surgery, the bariatric surgery, to lose weight and to alter their digestive system in order to treat with type 2 diabetes mellitus. But it's really significant that people should avoid the surgery when already diagnosed with type 2 diabetes mellitus, because of the diabetes has a prolonged wound healing proliferation symptoms. So which means any cuts to the skin or tissues, it's really take longer than expected to heal, which is not highly recommended for the surgery to treat the diabetes. So I explained the differences and the similarity between type 1 diabetes and type 2 diabetes. So let me just turn on the lights first. So the differences between type 1 diabetes mellitus and type 2 diabetes mellitus is that type 1 diabetes mellitus is an autoimmune disorder and cannot produce insulin. It rapidly develops in children and adolescents. However, for type 2 diabetes mellitus, it's a metabolic disorder that produces insulin, but it cannot effectively manage glucose level, slowly progressing in youth and adult and elderly. So type 1 diabetes mellitus cannot be prevented and incomplete cure, requiring daily insulin pumps or insulin injection. For type 2 diabetes mellitus, can delay or prevent with medication. We can delay or prevent with medication with lifestyle changes to the diet, weight loss, and insulin. The similarity of type 1 diabetes mellitus and type 2 diabetes is that both share the same symptoms, like excessive hunger, high blood glucose level, excessive thirsty, unexplained fatigue, high urination frequency, blurred vision, and disease or leg crampings. Both conditions lead to the same clinical manifestation like cardiovascular disease, nerve damage, kidney disease, and vision issues. Both conditions links to family history, genetic factors, and spread via direct and indirect transmissions, transmitted where the same household product uses through blood, urine, and bodily fluids. Both conditions inhibit sugar level in the bloodstream. So these are the similarities of type 1 and type 2 diabetes mellitus. Let's understand what are the prevention. So its prevention can done with lifestyle modification to change lifestyle with more physical activities, changing the diet, reduce weight, reduce hemoglobin level, regular taking prescribed pre-diabetic medication to control sugar level. This part is not a promotion, but recommending to join the United Essential Membership with Diabetes Australia government schemes to understand the prevention of diabetes in Australia because there is no current vaccinations. Again, these are pretty much lifestyle changes, and also recommending to consult with dietitians and the doctor about the diet management. As in previous video of type 1 diabetes mellitus, in the prevention part, I did mention what types of foods to consume to prevent the diabetes. And lifestyle modification with physical exercise also highly recommended. And it's recommended to check glucose level before exercise or meal. And it's pretty much for the topic today. Thank you for listening. References available per request, and see you in the next one. Bye.